Hello everyone, welcome to 2 Minutes in Medicine. This is Dr. Anand, consultant in critical care medicine from Bangalore. Today's topic is why we cannot use the directly acting oral anticoagulants in mechanical valves and why we should only use warfarin, which is the vitamin K antagonist. The mechanical valves, they pose a very high risk of thrombogenicity as compared to the bioprosthetic valves, as compared to the transcatheter valve in the descending order of thrombogenicity. If you see the virtuous triad, which we have learnt in our medical school days, it gets accentuated in mechanical valves. The incomplete endothelialization gives rise to complete non-stop thrombin generation in such patients, giving rise to what is called as thrombin factory. So the risk of thrombosis is increased. It is very high in the first 3 months after the mechanical valves implantation. Coming to the low flow states which happens around the valves, between the apposition of the valves and the nasal tissue, there is a stasis amount of blood. And the low cardiac output states, they fail to wash out the activated clotting factors in such patients. The regional turbulences, they also disrupt the laminar flow. The last part of the virtuous triad is hemostatic factors. In patients like chronic kidney disease, they have hypercoagulable state. The tissue factor release from the native wall, especially in case of TAVR, that gives us to complete again a good source of tissue thrombin, giving rise to high risk of thrombosis. And hence, the mechanism, if you come to the mechanism of action of these anticoagulants, the vitamin K dependent, that is warfarin, it classically disturbs this factor 2A, and also it depletes the functional levels of factor 9 as well as factor 10. So the thrombin generation itself is halted. Before the coagulation cascade goes out of control, the warfarin inhibits it. The directly acting oral anticoagulants, which classically affect the factor 10A or the direct thrombin inhibitors, that is dabigatran, they do not act on this thrombin. If we have to have dabigatran to be used here, it overwhelms the capacity of this thrombin, because 1:1 action of dabigatran, in case we need to have this, we need to use a very high dose of 620 mg in the real-line trial, which naturally gives rise to very high risk of bleeding. As the warfarin affects the classical pathway, affects the intrinsic pathway, which takes care of the factor 2, which is thrombin generation factor, which happens in mechanical valves, that is extremely effective and should only be used in mechanical valves along with antiplatelets in the first 3 months after the mechanical valves. The directly acting anticoagulants, which affect the factor 10 and direct thrombin, they should not be used because they fail to take care of all the 3 components of virtuous triad. Hence, we should not use them. Please use only warfarin in mechanical valves.